The fourth went in too clean, too fast, too military. Samantha, how did you do that so perfectly? Her colleague watched as she performed what looked like battlefield medicine in the middle of the night shift. Because Samantha Miller wasn't just a nurse, and when this patient's heart stopped beating, her real training was about to save a life and expose everything. In the next 30 minutes, everyone at the hospital would learn who Samantha Miller really was. Because some people wear nurse uniforms but never stay at a safe distance. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments which city you're watching from. And if you believe stories like this need to be told, hit that subscribe button. Samantha Miller was City Medical Center's most reliable night shift nurse. At 35, she had worked at the same institution for 7 years. She never had any problems during her shifts, kept patient records flawlessly, and never complained when faced with difficulties. Everyone on the team drew strength from Samantha's presence. She remained calm even in tense moments, solved the most complex situations, and always had the necessary equipment ready. Blonde hair pulled back in a practical bun, Samantha inspired confidence in patients with her gentle approach, soothing them with the softness of her voice. Her blue eyes quickly analyzed every situation, and the determination in her hands gave patients peace. Samantha's work team consisted of colleague Rachel Torres and assistant technician Tom Wilson. Rachel was an experienced 29-year-old nurse with 3 years of experience who knew the ins and outs of the cardiovascular unit. Tom was a talented 31-year-old technician who had been serving at City Medical for 5 years. But Samantha displayed a completely different character from both of them. Samantha's medical approach was far above standard night shift nursing. During emergencies, while others performed routine procedures, she could conduct much more detailed examinations. How do you analyze in such detail? They would wonder. Habit, Samantha would say briefly. But this habit was acquired from far from ordinary places. Samantha's equipment control approach was markedly different from her colleagues. She would examine every piece with military precision, reviewing medical instruments, monitors, and emergency intervention equipment, as if preparing for a vital operation. Sometimes others found this sensitivity excessive. "We're just night shift nurses, Samantha, not Navy SEALs," they would joke. Samantha would smile and not respond, actually knowing that both groups were thinking incorrectly. Samantha's emergency management abilities amazed even the chief physicians. "Where did you learn this leadership capacity?" they would question. "Experience," Samantha would answer, always vague, never going into details. And these experiences came from areas completely different from ordinary nursing. Samantha Miller had joined the Navy at age 18. When she joined the Navy, she chose the Navy SEAL Medic program. After basic military training, she was selected for advanced training. Navy SEAL medical training was the world's most comprehensive combat medicine program. But this was just the beginning. The real specialized training was yet to come. Special Operations Medical Course, 20 months of intensive training process, medical intervention in combat zones, life-saving with limited resources, surgical operations under fire. Samantha was selected for the top 3%, and this training would be very useful that night at the hospital. "A SEAL medic isn't just a medic," said Training Commander Senior Chief Rodriguez. "You're the person making life and death medical decisions. Even if resources are limited, even if you're under enemy fire, you will keep wounded soldiers alive." Samantha had embraced this mentality. Achieving maximum medical impact with minimal resources, performing surgical intervention in combat conditions, displaying medical leadership in critical situations, and medically combating technical limitations were her basic principles. The most difficult part of her training was medical operations in combat zones, wounded rescue under enemy fire, performing surgical intervention with basic materials, and having to develop improvised medical techniques. Samantha had acquired extraordinary abilities in these areas. In her first deployment, she was with the Forward Base Medical Team in Uruzgan Province, Afghanistan. Medical operations in combat zones, treating wounded personnel after bombing attacks. Samantha's most critical intervention was rescuing personnel seriously wounded in an IED explosion. In her second deployment, she was with the Special Forces Medical Support Team in Iraq, emergency interventions in urban combat zones, medical assistance in high-risk missions. The techniques she acquired in these missions were methods never used in civilian life. Her third deployment was classified operations on the Syrian border, medical interventions in covert operations, support for Special Forces personnel. Samantha had gained medical expert-level competence under all conditions. Over 10 years, Samantha had successfully performed 149 critical medical operations, never leaving any incomplete due to combat conditions. So why had she left the Navy to become a nurse? This story was more complicated. PTSD, adaptation problems, civilian life difficulties. Samantha's transition hadn't been smooth. High-stress medical work felt familiar, but civilian procedures were different, and this tension would explode that night. After receiving an honorable discharge in 2019, Samantha had transitioned to the civilian healthcare sector. She used PTSD rehabilitation, adaptation coaching, and career change support. Hospital nursing had been a perfect match. It reminded her why she became a SEAL medic, helping people at risk. The hospital environment was a predictable order after years of combat environment. Peace was welcomed with satisfaction. When City Medical Center hired her, Samantha was overqualified. Nursing license, 10 years of military medical experience, SEAL medic certificate. But the hiring panel didn't ask detailed questions. They were pleased to reach a qualified candidate. "I've always loved healing people," Samantha had said, and this time it was completely sincere. Daily work was easy compared to combat medicine, patient care, basic medical interventions, standard procedures. But Samantha was doing much more. She examined every case from a SEAL medic perspective. She identified possible emergency scenarios in advance. She anticipated how medical crises might develop. "Samantha, how do you know emergency medicine management so well?" colleague Rachel would say. "Observation," Samantha would say. "Every emergency is instructive." This observation came from 10 years of combat medicine operations experience. When her shift began that Monday night, City Medical Center radios began reporting heavy patient traffic. The emergency department reported that multiple trauma cases would increase throughout the night. But Samantha was in the cardiovascular unit on the 4th floor and needed to monitor 45 post-operative patients. "Samantha," the shift supervisor had said, "it's going to be a busy night. Extra attention may be needed." "The cardiovascular unit is always critical," Samantha had replied. "We're ready." Samantha, Rachel, and Tom had started their shifts, performing night checks on post-operative cardiac surgery patients, vital signs, medication protocols, complication monitoring, standard but critical night nursing. While Rachel was reviewing patient reports, she said, "How do you work so calmly, Samantha?" "We've been working together for 7 years. I've never seen you panic." Samantha smiled gently and replied, "You gain experience over time." Rachel wondered, "Experience? I still get affected by intensive care patients. You act like you've seen much more difficult situations." Samantha had hesitated for a moment. "Everyone's story is different, Rachel. What's important is our current performance." But Rachel's questioning had touched on a sensitive subject. For 7 years, she had kept her 2 different identities completely separate. This night, this separation would end. 1:45 a.m. Critical alarm. The warning system at the nursing station was activated. Room 318. Cardiac arrest. Heart stopped. Samantha and Rachel initiated emergency procedures. They ran pulling the crash cart, standard approach, CPR, defibrillation, advanced cardiac life support. When they entered the patient room, the 71-year-old patient was unconscious. Post-cardiac surgery, serious complications. Rachel began applying standard ACLS protocols. Samantha was helping, but something had changed. Samantha's body language had evolved. More precision, more efficiency, more military approach. While Rachel was performing CPR, Samantha was preparing the defibrillator. However, the patient's condition was deteriorating. "Samantha, the standard approach isn't working," Rachel said. "We should call a doctor." Samantha examined the patient. No pulse, blood pressure dropping, respiratory failure. But her assessment was much more comprehensive. "Rachel, this isn't just cardiac arrest," Samantha said with authority. "Tension pneumothorax has developed. The pressure in the chest cavity is preventing normal blood circulation from the heart." Rachel couldn't hide her astonishment. "Samantha, how are you making this diagnosis? We don't even have an X-ray." Samantha didn't answer. She pulled out a special needle from the equipment cabinet, a military medical device designed for chest decompression. "Samantha, stop. What are you trying to do? We don't have this capability." Samantha's hands went into automatic motion. 10 years of SEAL medic training was activated. 1:47 a.m. Intervention began. The chest decompression procedure started. Samantha's hands worked with surgical precision. 10 years of SEAL medic training had fully activated. She visualized anatomical landmarks in her mind: second intercostal space, mid-clavicular line. She placed the needle at exactly the right point. She had performed this procedure dozens of times under enemy fire in Afghanistan. Now, in a sterile hospital environment, but with the same precision, the same determination. It was immediately effective. The trapped air was released. The patient's breathing pattern returned to normal. Cardiac rhythm began to stabilize. But Samantha hadn't finished her work yet. Rachel was frozen. "Samantha, this is surgical intervention. Nurses don't have this kind of knowledge." 1:51 a.m. Second complication. Samantha detected the second problem: distension in the patient's neck veins, JVD, jugular venous distension, classic cardiac tamponade symptom, a sight she recognized from the battlefield, cardiac injuries following blast injury. "Rachel, pericardial effusion is developing, fluid accumulation around the heart, Beck's triad, high venous pressure, low arterial pressure, muffled heart sounds." "Samantha, where are you getting this information? These are doctor-level diagnoses." Samantha brought a special portable ultrasound device from her personal equipment. She imaged the patient's heart. POCUS, point-of-care ultrasound, a life-saving technique on the battlefield. There was indeed more than 200 milliliters of fluid accumulation in the heart sac. Rachel was now in extreme agitation. "Where are these knowledge sources from? This technology isn't standard nurse equipment. These subjects aren't in nursing education." 1:54 a.m. Third and final intervention. Samantha was performing the third critical intervention: pericardial needle aspiration, draining the fluid in the heart sac, sub-xiphoid approach with echo guidance. Her hands showed perfect coordination, the technique she learned in Iraq, minimally invasive but maximally effective. "Samantha, answer me. Where are these equipment from? Where is this expert-level surgical ability from?" Samantha's hands were covered in blood but showed rock-steady stability. No tremor, no hesitation, as if she had applied these life-saving procedures thousands of times. And she really had. "Rachel, this isn't discussion time. We need to keep this patient alive." 2:03 a.m. Total operation time, 16 minutes. When the patient reached complete stabilization, Samantha stopped. Vital signs normal, cardiac output restored, respiratory function optimal. She made direct eye contact with Rachel. There was nothing left to hide. Rachel's jaw dropped. "Were you a Navy SEAL?" "Yes, and right now I'm using this expertise to save lives." Dr. Michael Rodriguez, cardiovascular surgeon, responded to the emergency call. When he entered the room, the patient's condition was stable. "What happened?" he asked. Rachel was still in shock. Samantha performed interventions. Dr. Rodriguez evaluated the patient. "This chest decompression is flawless. The pericardial aspiration is also expert level. Who did these?" Samantha was quietly cleaning her hands. "I performed them, doctor." Dr. Rodriguez was amazed. "Nurse Samantha, these interventions are surgical level. They're not taught in nursing curriculum." "Doctor, I was a Navy SEAL medic. I served for 10 years. Afghanistan, Iraq, Syria." Dr. Rodriguez was stunned. "Navy SEAL medic. You're a Special Forces medical specialist. In the past, I'm a nurse now." Dr. Rodriguez nodded respectfully. "These interventions saved this patient's life. We would have lost him with standard protocols." At the end of the shift, Samantha and Rachel sat in the break room. "Samantha," Rachel said quietly, "we've been working for 7 years. You never mentioned this. Because the past should have stayed in the past, Rachel. But these abilities, this knowledge, you're a real warrior." "No," Samantha said decisively. "Warriors fight." "I only protect life?" Rachel approached understandingly. "Then why did you end your SEAL career with this level of abilities?" Samantha experienced a long silence. Finally, she spoke. "In the last mission, there was someone named Kevin Thompson, 26 years old. He was seriously injured in an IED explosion. I fought to keep him alive for 8 hours, but I couldn't save him." Rachel's eyes filled with tears. "That night, I made a decision. Combat medicine equated to too much pain, but here in civilian environment, I only save lives. For Kevin's memory, every patient I save is in his honor." The following week, changes occurred at City Medical Center. Samantha's story spread carefully through the hospital community. Dr. Rodriguez offered Samantha a special proposal. "Samantha, would you be interested in working with our cardiac surgery team?" Samantha declined. "Doctor, I prefer to continue my nursing role, being close to patients." However, changes were implemented. Hospital management wanted to benefit from Samantha's military medical background. "Samantha, can you provide advanced life support training to night shift nurses?" Samantha accepted. Every weekend she began teaching her colleagues the techniques she had acquired from combat medicine. A month later, Samantha received an unexpected letter. It was from Kevin Thompson's mother. "Dear Samantha," it began, "the Navy told me about your final efforts for my son. I also learned about the lives you've saved in civilian life. If Kevin were aware of this, he would be proud of you." Samantha had an emotional reaction while reading the letter. Rachel found her with the letter. "Samantha, she's right. Kevin would be proud." Samantha made a positive gesture. "Maybe so." Today, Samantha Miller still continues her night shift duties at City Medical Center, still with the same humility and professionalism. But she's no longer hidden. Rachel knows the truth. Hospital management acknowledges her value. Samantha has so far trained 18 nurses in advanced life support subjects. Each has saved lives using techniques learned from Samantha. She keeps Kevin Thompson's photo in her locker, not as a failure reminder, but as a source of inspiration. Real heroes don't wear uniforms. Sometimes they wear hospital scrubs and quietly protect lives during night shifts. 6 months later, Samantha received communication from Afghanistan. It came from a soldier she had previously treated. "Samantha," the young man said, "through your influence, I chose a paramedic career. Now here, I'm saving lives using the methods you taught me." Samantha closed her eyes. The circle was complete. Every soldier saved in combat context carried the potential to save others. Every patient saved in civilian life was part of Kevin Thompson's legacy. The power of pain had transformed into the power of healing. Real heroes don't abandon their duties. They just change their duty locations. Samantha Miller's story is real. She's still there in hospital corridors continuing to save lives. Maybe there are similar hidden heroes around you too. Maybe your nurse, your doctor, or your healthcare worker also experienced very different lives in the past. Show them respect, because they deserve much more than what appears. If this story affected you, share it, subscribe, and help these important stories continue. See you in the next legend. And remember, your healthcare worker may have the ability to overcome extreme situations you'll never know about. Service never ends. It just changes uniforms.